behalf of Region 7 and the Ask for Respect Supplemental Grant, we want to welcome you to our series of interviews focusing on the perils and pearls of lessons learned regarding COVID-19. Our hope is to share the lessons our colleagues have learned and to assist you with your healthcare journey during this pandemic. Thank you for listening.
Hello, everyone, and thank you for joining us today. I am joined today by two of my friends and colleagues, Mounica Soma and Des Agagah, and they are employees here at Nebraska Medicine and UNMC. And today we're going to spend a little bit of time talking about how the last year and a half of experiencing COVID as a public health professional, as a healthcare provider, having friends and family in other countries has affected you. And so I'd like to introduce each of you to give an introduction and then tell us a little bit about yourself, your family, where you're from, and we'll start with Des.
I'm Des Agagah. I'm originally from Togo in West Africa. I moved to United States about exactly on the 15th of April 2000. So it's been 21 years. It's a long time.
Yeah, it's a long time.
Yeah, it's a long time. And I often go back home. Last year I went back home, not last year, but the year before COVID year, I went back home twice. And I went to Togo, I went to Ghana. One of my trips in Ghana was to visit the hospital. So I see how they do things, and in Togo also I see how they do things. So I work as a respiratory therapist at UNMC. I've been with the Biocontainment unit the past 3 years, where I learned a lot of stuff, and all those things that I learned helped me a lot during COVID. I have family back home in Togo. I have my 2 kids back in the US in here. So that's about me. That's all about me so far.
Great, thanks, Des. Mounica?
Hello, this is Mounica Soma. I work as a database analyst here at Nebraska Medicine. I was born and raised in India, the southern state called Telangana. I did my schooling as well, my bachelor's in the same place. I used to live with my parents. My dad is a civil engineer and my mom is a homemaker. I also have an elder sister. She is married and is currently a German resident. My passion towards healthcare and thirst to learn more has brought me to the United States. After I completed my master's, I joined Nebraska Medicine Infection Control Prevention team last year. And the last I visited India was in 2017. So that was last when I saw my parents and friends out there. So the sad part is that both of us, myself and my sister, are far away from my family.
And you said your sister is living in Germany right now.
Yes, she is in Germany right now. And she is also blocked over there. She has no way to come out since there's a travel ban.
Got it. Okay, well, thank you guys for telling us a little bit more about yourselves. I realized that I didn't introduce myself. So I'm Angie Vasha, and I am a nurse here at Nebraska Medicine. My current role is to serve as a director of isolation and quarantine services for special pathogen preparedness. And I work on a variety of our biopreparedness and emergency preparedness grants. And I'm fortunate to work with both Des and Mounica in slightly different roles across different programs. And I think that the conversation that we're having today is one that has not necessarily been given enough time or attention, especially over the last year. And so I want to just ask you guys to tell us a little bit about how you've seen the experiences be different and the way that you've seen COVID play out in both the community and the healthcare setting in the United States compared to the experiences that your friends and family have had in either India or Germany or Togo, or I think you also said, Des, that you've been back to visit your family and friends in Ghana. And so just wanted to give an opportunity to talk a little bit about what you've seen as the major differences. And then if you could talk a little bit about what kind of an effect that's had on you being here in the US healthcare system and trying to, keep in communication with your friends and family back home. Yeah. Des, do you want to start?
Yes. COVID, I think COVID affected everyone kind of the same way. Mm-hmm. When I look at it, I kind of see the healthcare system in Togo, where I came from, is not as solid as the healthcare in the US. When I went back home and toured the hospital, I didn't see any ventilator. I didn't see any BiPAP. And when COVID hit, I was worried. When I worked in the Biocontainment unit, and I saw how many people we put on the bed and how sick people were getting and needing help to breathe. I was like, this is it for me. I don't think any of my folks will be left because they don't have what we have in here to take care of these people. So it was worrisome. It was stressful.
Mm-hmm.
And when COVID started, and the death toll in the US compared to the death toll in Togo was, at least what was reported, was kind of low. So my friend and family, they were in disbelief. When you talk to them, they say, well, COVID is American disease, is West Indian disease. So we sure we got it. We're not gonna get hit. Up to now, we are okay. Until COVID started getting in Togo. At that point, now we all scared. My mom lives in Togo right now. There are two of us. My sister lives in Canada, in Toronto. So my mom relied on other people to run errands, to do things for her.
Right.
Now here's COVID. You can't visit people. You can't have anybody come over. Now we have problems.
Right.
People can't visit her anymore. If she gets sick, what am I gonna do? I'm not gonna be able to travel to Togo to see her, and she's afraid for me. She called all the time, and I want when you see on your call ID a number from Togo, you will be like, is this the day they're gonna tell me so and so got COVID and is no longer around? So there's a stress knowing that they don't have the healthcare solid to do it. But on the other hand, the good thing is they come up with their own way to deal with COVID. They come up with all kind of medications and chloroquine. When chloroquine came first in Europe, they were on top of it because it is something that we use all the time for malaria. So they have access to it. I remember the first thing my parents did is they get DHL and send me 100 pills of chloroquine. They say, oh, you need
they
to
want
have
to
it.
be helpful, right? They
right.
want you to have
they want
what
to
they
be helpful,
think
you know.
need. Yeah.
So overall, it hit everybody the same way. It was stressful. They were in disbelief. And at the end, they were worried and scared at the same time.
Mm-hmm. How is the COVID numbers? How are the COVID numbers looking in Togo now? I think, we don't necessarily get a lot of international news on the local news channels here, especially from African countries. And so I'm wondering if you can talk a little bit about how the case counts are trending there, and then we'll ask Mounica the same questions.
The COVID numbers are very low compared to the US. I'm not sure if it's because they're not testing. They test, but people don't go just test themselves. People don't want to. People don't want to unless they're very, very sick. I have a friend of mine who's very close to the government who gave me some of the info. In Togo, they open up an area of hospital that we call the Chinese hospital. The Chinese went to Togo and they have an area where they run that hospital. So they use that hospital as COVID unit. The last I heard from them, the numbers were less than 100.
Wow.
They have less than 100 people. And when I read on the news, the deaths were less than 1,000. So I'm pretty sure they're okay. The numbers are, compared to the US, very, very low. Also, let's say this, Togo is only about 7 to 8 million people.
Sure.
And out of that 7 to 8, we have about 6 million living in the capital city of Lome.
Mhm.
So that's where all the action happened. So
Right.
compared to the US, numbers are low, death toll is pretty low.
Monica, can you talk a little bit about your family and friends and maybe what their experience has been like, and kind of the way that waves have spread through? I think it's hard to talk about the entire country as a whole, but I know that you keep in touch with a lot of folks, and so maybe the country as a whole, and then specifically about the state where your family is living.
Sure. Let me just describe a few differences, how the healthcare system in India has been like when compared to United States. And then I'll just share my experiences my family has been going through. So I feel that there are major differences when it comes to access to care in India, in the US, and the way it is handled socially as well politically. I feel the patient to doctor ratio in India is much lower when compared to the ones in US. The major part of mortality as well as morbidity is due to lack of basic healthcare availability. The healthcare system right now in India is fragile, fragmented. I could say it's collapsing. Most part of this it's attributed to social and political reasons. I feel the government officials have declared victory over COVID-19 too soon, that they lifted up the restrictions. And so many of them have become non-compliant with masking and social distancing protocols. So as a result, large mass gatherings like election rallies and religious festivals have contributed to a huge spike. When I say spike, it's not just a spike, it's too much. It's, the cases just a month ago, it was just hundreds. It wasn't 600 or 800 cases a day, but now it has rise to 22,000, almost 22,000 plus cases a day. Yeah, so the state where I live, it's the fifth most affected state. The country, one good thing is that the country is now, the government has realized that this is going to impact more and more, and the outcomes will be more severe. So it's striving hard to curb the rise by imposing curfews, increasing hospital beds, gathering supplies from other countries, and also speeding up the process of vaccination for adults over 18. It's the death counts also have been so high. It's around 750,000 deaths over the last few weeks. The last I read, yeah.
And so we had the opportunity, earlier last week to speak with some other colleagues, one from Australia and one from Nepal. And similarly to what you're saying, that's happening in India, in the country of Nepal, very similar outcomes and very geographically, in proximity to each other. So that makes good sense. And I think one of the things that struck us when we were doing that discussion was just the experience that people have had as they went to the hospitals to try to find their family and friends or to try to get updates, and realizing that there were just a lot of dead corpses in the hospitals, and that there were no updates to give because nobody had survived. And so I think that that's just really, it's very devastating to think about that that's happening right now. And I think that just the toll has been so different at different phases that it's really hard to keep up. And I think because we've heard so many peaks and valleys, it's easy to become desensitized in it. And I appreciate you both being willing to kind of talk about what's happening to your country of origin, your family, your friends. It's not easy, I think, to talk about. So I don't know if Monica, you feel comfortable sharing kind of what experiences your family and friends have had as they've sought healthcare in this system that seems to be collapsing under the weight of the case counts.
Mm-hmm. As I mentioned earlier, due to the spike in the cases, several states have imposed this kind of localized lockdowns, curfews, and curbs on movement over the last month. The state where my parents live is also under lockdown. So it's been hard for them to just go around and buy the needed groceries. As well, on the other part, some of the relatives have passed away with COVID and the so-called black fungus. So this black fungus has been roaming around over the last couple of weeks. It's called the mucormycosis. And I heard that this is because the virus resides if the humidifiers or the oxygen concentrators, they're not cleaned up very well. Some of our relatives, it was really hard for them to find a spot in the hospital. They went around for 4 or 5 days, roaming around, ready to pay bucks of dollars for just one hospital bed. They finally found it after a week later, but then their health has deteriorated so bad that it's very hard to recover their lungs back to normal. 90% of their lungs have been totally damaged. So it's not just about the hospital beds. Due to the increased number of people getting infected, there has also been a decreased supply of oxygen. So United States has helped so much for the country by providing some oxygen concentrators and the medication supplies like the remdesivir and all. But then, India is the second most populous country, and it's
A lot of people.
it's always yeah. It's
So
always been hard.
Sorry, Monica, I didn't mean to cut you off. I was going to ask, how are your families? I know, as you had said, it was very worrisome for you, and I know, Monica, you've talked about just how your family and friends were trying to find access to healthcare and couldn't. On the other side, when the waves were hitting here in the United States and specifically in Nebraska, early on, and then as we had different peaks over the course of the last year, knowing that you're working on the front lines in an infection control and prevention team, and knowing that you're providing respiratory therapy services, which is as much on the front line as one can be in a respiratory pandemic. How did your family and friends respond to the roles that you all are playing here in the response? And how did you provide reassurance back to them that you were keeping yourselves safe here? You can start, Des. Thanks.
Oh, okay.
Sorry.
In my case, my parents were worried. My friends will ask me, do you have to do that job? Do you still have to go to work? Why can't you find, I remember my aunt asked me, well, why can't you find something else to do? Well, why do you have to do that and go to the hospital? I always tell them, we are well equipped, we know what we're doing, and we're trained to do it. And this is not the time for me to just run away, because I have confidence on what we have and how we're handling this. So it was, they worry for me. I can hear, because I get many calls just to check on me. I get calls in the middle of the night. I get calls all the time to see, and you can hear, they don't ask you anything. They just want to make sure you are okay. So for me, it was very emotional. You get a call, and for me, I worry for them, and they worry for me. So it was a different experience. That I never want to experience that again. We're not all clear, but it was different.
Monica, how about you? Knowing that you're right in the middle of infection prevention and control, you're supporting a lot of teams that are going out into the community and into some of the hardest hit areas across the state. How did you respond to questions from your family and friends back home?
So the thing that worries me the most is the travel ban to and fro from India. So it's really hard being away from your parents and then giving them some emotional support. But working in the infection prevention team has helped me so much. So every day I call my parents, explain them about the social distancing protocols or the masking or the PPE, or when it comes to everything trying to be safe from people around and just moving around in the community, what steps to take in order to be safe. But the thing that worries me, every day I keep thinking about this, if in case my parents or close friends get infected with the virus and they need my presence, I will not be able to get there because of the travel ban. So I think this is the most most part and the critical part of being away from the family. But being in the infection prevention team, I always support them by just transferring whatever knowledge I have, whatever I'm experiencing here, whatever we are communicating with the facilities right here, I just transfer the knowledge to them. So that's been helping them out. They are vaccinated right now, they follow all the protocols, take all the precautions, and they also educate others in the community in my neighborhood. So I'm happy for that.
Yeah. So I think that, you guys have talked a little bit about the psychosocial impact of, you're worrying about your family as things are happening asynchronously and they're worrying about you here. We saw a lot of supply chain fragility in the United States when we thought about access to personal protective equipment, access to oxygen in some of our larger cities on the West and the East Coast. Wondering if you guys have heard anecdotes back from your family and friends on, limited supplies on like cleaning and disinfectant products, like all of the, early on when we were selling out of toilet paper and hand sanitizer and bleach. Was that happening in your hometowns as well? Yeah.
I'll say yes, because at one point people were like going crazy to just buy supply. So in Togo, for example, they are corn-based meals, so people buy a lot of rice, a lot of corn, or a lot. Well, there's a food we call maiseka. I remember my mom going in and buy all kind of food just to put on side in case she can't go out anymore.
Right.
So it is the same. Now, in terms of PPE and mask and other stuff, I think they were very creative. They come up with their own sanitizer. I'm not sure if it's been tested and approved, but they use alcohol. They have some strong liquors out there that they use, they mix them, and that's how they get away with sanitizer, because I don't think they have enough of those Perils that we use in the hospitals here. So they use alcohol, they use some herbal things, they just create their own things to get around. PPE, I see my parents, they quickly use their own clothing to make their own mask. In the hospital, I haven't heard a lot of news because the case, like I said, the case went very, very, didn't spike as much as in other places. So I didn't hear much of the lack of PPE in the hospital, but in the city, they were able to make their own masks.
What about you, Mounica? I know you had talked a little bit about trying to get access to oxygen or some medical supplies, but what about the kind of normal things that you think of getting on a day-to-day basis? Are you seeing, either early on or now that access has changed?
I feel that access has changed now when you compare it with the last month, because people are just coming forward, the local suppliers. They're trying to make solutions out of just reading out the ingredient list. I'm not sure how potent they would be, but they are trying to protect themselves, I could say.
So I think, the other thing that I was thinking about, and, we talk a lot about how often you guys have been able to go back and visit. And so like Des, you were able to travel pretty frequently before COVID, and Mounica maybe not quite as frequently, pursuing a lot of studies and things like that. But wondered if y'all could talk a little bit about how you're overcoming those restrictions to let you travel, and kind of if you feel like you've made more of an effort to stay in touch with people now than you previously had, now that you no longer have the option to travel in person.
I think I always wanted to go back. I remember a couple months ago, I took time off, took about 2 weeks off to go home. And when it's getting closer, my mom is like, don't come, you don't have to come, just stay, because when you show up here, people are going to be scared of you. It's not going to be just like before, because they see people coming from the US, from Europe, as the one that are bringing the disease. So I would prefer that you just stay there, we'll keep in touch, everything is fine so far. So every week I feel like I need to go again. I need to go and make sure they're doing what they're supposed to do. Even though on the phone all the time, I always tell them, put your mask on, how to take your mask off, don't take it off and rub it in your hand and put it back on. All those things that we learn in biocontainment, we learn at work. I always communicate those to them. But you have that feeling that I wanted to go. I wanted to go see how they're doing. And that's hard. That's hard knowing that. In my case, something that I fear the most is there's two of us. What about if my mom passed away right now? How am I gonna handle that part? I'm just gonna sit in here and rely on people to handle that part of it. It is stressful.
Absolutely.
And I'm sure she worried for me. I remember the day I called her and told her that I had COVID. But I waited till I was almost, I know that now I'm out of the difficult part of the disease. And I called, and I was talking to her on the phone, and I was my aunt sitting next to her. And I hear her saying, what's going on? Why are you shaking? So I can, even though I keep telling her I'm fine, this is me, everything is fine. It's been almost 14 days. I'm okay now. No, she was like, she was shaking. And that's how stressful, you feel lonely, even though, I'm used to be away from them. But now like not being able to go, not being able to decide where and when to go, you feel lonely.
Right. It makes it much worse.
It makes it worse. I call them more often. WhatsApp, the technology has evolved, so it allows us to make calls now without paying a lot of money. Most calls with the internet are free, so I call them more often. I call my people, my friends more often. They rely on me. They call me for advice. When a couple of them got COVID, they quickly call me and say, "What should I do? How should I handle this?" So that's it is stressful. It is lonely. You feel lonely, even though you are away. You feel lonely.
Right. And I think that that's something that I have. The majority of my family lives here, and so I tend to take it for granted that everyone has that support system. And so I think it is really important to kind of, for all of us to be able to think about what are our peers going through that we might not know about, and just that added layer of, on top of the forced social isolation here, but then knowing that much of your support system is further away, and you can't just go see them when you want to. And so I think the question is, what do you do to deal with that added stress? And I think, Mounica, I would ask you that same question. I know that you were planning your wedding and back home, and, a lot of those plans have had to be changed and delayed. And, that wondering if you would talk a little bit about, just kind of how that has been for you. And then I'd ask both of you if there are things that you've found that work well, that you would pass on to others who might be in the same situation and haven't had the opportunity to talk about it.
Yeah. So the last I visited India was in 2017. And after that, I just took up my master's studies and I wasn't able to get back. But in 2020, when I decided to go back, COVID has stopped me from going there. And then the situation was about to subside, and then we planned our wedding date. When I heard the news that the COVID cases have spiked up, I have had sleepless nights for almost a month or so. And when I heard the people are dying, with Leslie, I felt so bad. I felt so helpless and nervous being away from them. It's really hard to be here stress-free when I know my family and friends are suffering so much out there. I had to change my plans. I had to be so cautious and careful of my family and parents each and every minute, I would say every day. But I was able to get out of this just because of the ICAP team. The ICAP team has come forward, the next team too. So everyone started sending me messages, the infection preventionists. They told me that they would help in every way possible. So our medical directors have called me. They are like, what kind of help do you need? What kind of advice do you guys need? So I'm so thankful for the Nebraska medicine team for coming down and instilling a kind of support strength. That means a lot to me. I just can't express my thankfulness to the team.
I do think that we have a special family environment here, you know, with our teams that we work on, with our biocontainment unit team, with the employees that we work closely with at Nebraska Medicine. I do feel like we have kind of fostered a culture here. We're kind of all for one for all environment. I wonder, you know, as you guys are talking, just if there are any pieces of advice that you would say. I know that everybody reacts to situations differently. But would you give advice to folks who don't have family and friends living abroad? And how would we best support or even check in on colleagues who might be, you know, suffering in silence, so to speak?
Hey, what I can think of is that when people see you, they don't think you worry for yourself, and now you worry for somebody that you cannot even go and help. That's the difficult part for me. So for people just to ask you how you doing and how is your family, I remember when people ask you how's your family, you will go on 5 minutes of talk without realizing that you just tell them everything about how your mom is doing, how your friend is doing, how whoever so-and-so parent died from COVID. It helped. You just straightforward start talking about your family. So I think it helped when people ask you how you doing, and at the same time, hey, how's your family? Are they okay during this COVID? For me to cope, I don't know what I did. I just leave. Sometimes I try to think they're okay. I can't pinpoint anything that I've done, and I just, you know, it will be okay. I have rely on my faith. They will be okay because it's helpless. What are you gonna do? In the United States, they're in Togo. There's nothing I can do. So they'll be okay. I have faith in God that God will protect them. While I'm here, I talk to friends. Being in the biocontainment, you know, we make friends for working all together all the time. I remember one of the guy in respiratory therapy. He's always Frank. Frank is the one that he always asks, "How's your family?" He doesn't know that by asking that, he just give me some sense of relief, and then by telling him they're okay, I'm telling myself that I'm okay and they're okay. So it's difficult, but I rely on my faith. I trust God, they will be fine. I have support unit in here. I have people that I talk to, friends and families around, and coworkers, people from Nebraska medicine. I remember Dr. Sully, every time he asks you, are you okay? Darcy always asks me, are you sure you want to stay on the biocontainment unit? You sure you're doing okay? So it helped. It helped in many ways.
Mounica, how about you? Anything that you would give advice for others to think about, or things that have really helped you kind of cope with the stress of the situation?
My first advice to the people out there would be, just don't take the situation for granted. Things can change anytime. So just keep practicing the infection prevention guidelines, social distancing guidelines, masking and all those. And I would say believe in yourself, be strong. At the same time, talk to people around you, share your experiences. So this would help them take care of themselves.
Yeah,
I hope the situation gets back to normal soon.
And I think you make a really good point, that there were, lowering case counts and things were looking, pretty stable in India. And so they were starting to relax restrictions and open things back up. And so knowing that and seeing what we're starting to loosen up here in the United States, does that make you worry that we will see kind of that same surge in cases here that we're seeing in India?
Yeah, that worries me the most. So the mutants, the strains, the variants that are right now in India, though they are so dangerous, the virus has been spreading so fast, and people are dying with acute respiratory failure and all of the serious acute conditions. If I'm sure the variants would come down all over the world, but with the government taking decisions of easing these restrictions of the masking or the social distancing, I would say it would be the important part on oneself to take care. I'm sure, for some reason, my sixth sense, it says there's yet more to come. So it's not for granted. So, right.
Well, I want to thank you both for your time today. And I want to just take a minute to ask if there's anything else that you think you want to share about how this has affected you overall, or any points that you think would be helpful to others who might be kind of going through these same situations that you both are.
Like we said, like she just said, believe in yourself. Do the right thing. Don't be close-minded. Don't try to think, oh, the disease is not here. It's not gonna get me. No, try to trust yourself. Do the right thing. Listen to the healthcare workers and be safe. Mm-hmm. Be safe. Practice social distancing. Get vaccinated. My mom got her vaccine. A lot of my friends refuse to get vaccinated because they don't believe in the vaccine. They don't believe in this particular vaccine. They don't think, they think this is made by the Western country to just cause harm to the Togolese and to the African community. So many people don't want a vaccine, but stay safe, practice social distancing, and do what you needed to do to be healthy.
Yeah, that's a great point, Des. I think that, wear a mask, wash your hands, practice the physical distancing. I do think that this has probably been one of the most divisive and sensitive vaccine campaigns that I've seen in my time as a healthcare worker. And so I do appreciate you shedding a little bit of light on that. And just, being cognizant that we have to, as healthcare workers and as public health professionals, we have to be willing to have those difficult conversations and be able to come forward with facts when people are afraid, when people are, reading into a lot of the theories and conspiracy theories that are circulating around the vaccine. I think it is our responsibility to be armed with facts. And we see that, here across the United States as well, a lot of vaccine hesitancy, a lot of fear around the vaccine. And you're right, we do need to be able to provide reasonable information back to folks. So thank you for that. Mounica, would you add anything to that?
The only thing I would add is be a responsible person. Take care of yourself and take care of the community out there. Get vaccinated. That's the most important thing. Though the situation in India is so worse, people who got vaccinated with their first dose or fully vaccinated, they are the hospitalization rate has been low in such cases. So I'm sure the vaccine will help you in some or the other way, but don't refuse to take it. So take it, go today and take it.
All right. Well, thank you both again. I want to thank you for your time and for being willing to spend your afternoon talking about yourselves and your family and just kind of how you have persevered through the last year and what you'll be doing over the next months as we continue to try to live our lives in the face of the COVID pandemic. So thank you both.
Thank you.
Thank you.
Hello, everyone. I am Angie Vasha. I am a nurse leader here at Nebraska Medicine. I serve as the Director for Isolation and Quarantine Services, and I get to work in our Nationally Emerging Special Pathogens Training and Education Center as our Director of Readiness Consultations and Metrics Development. Today, I am joined by two of my great friends and colleagues, Kate Boulter and Sami Vasistha. I'd like them to introduce themselves and tell us a little bit about their background. So we'll start with Kate.
Oh, hi, Angie. So yes, I'm Kate Boulter. I'm the nurse manager for the Nebraska Biocontainment unit. And for the purposes of this conversation, I was born in Scotland, but my family emigrated to Australia many, many years ago. I don't even want to tell you how many years ago it was. But, due to COVID, we're not able to see each other in person anyway. But yeah, that's pretty much, what people need to know about me at this time.
Thanks, Kate. Sami?
Hi, everyone. I'm Sami Vasistha, originally from Nepal, moved to United States about 24 years ago. And most of my family members are still back home in Nepal while I pursue my career here as a NETEC Program Manager, work along with Angie and Kate.
Great. So today I'm really excited to have you both here. For the purpose of this podcast series, we primarily focused on hot topics around COVID-19 and clinical scenarios and best practice guidances relating to public health. But especially over the last few months, we've seen just an emotional response to a lot of the surges that are happening both domestically and internationally. And we really wanted to take a little bit of time to talk with each of you about your experiences, a little bit more about how the experience has been for you both being here in Nebraska and having family and friends living abroad. And we understand that you both still have many family and friends living in two very different locations. And so I think it'd be great if you could tell us a little bit about them and how you've kept in touch with them over the last year and a half and more recently.
Do you want me to go first?
Sure.
Yeah. So yes, you're right. It's definitely been a very challenging over a year now since we've been dealing with COVID. My job keeps me very busy. As you know, I work with you, and we have been doing a lot of education and a lot of outreach, and as well as care for patients with COVID. But my family being in Australia, it's always been a little bit of a worry for me because, not knowing what the situation is at that time and knowing how grave it can get. We've tried really hard to keep in touch as much as possible. And we do that mainly, through Facebook, through video, phone calls, things like that.
And I think, prior to COVID, how often do you think you were getting to see your family, and how has that changed over the last year?
Mm-hmm. So I wasn't able to go and visit them all that often. It wasn't like we could go every Christmas or every Mother's Day or anything like that. I did just go there 3 years ago. So I'm really glad that we had that time together. Mm-hmm. One of the things about Australia is they've done really well during this pandemic, but the offside of that is that, they've really restricted international travel into their country. And it's looking like maybe even 2024 before we'll be able to travel there again. So that's a long time, especially when you've got, family members that are, not young chickens anymore.
Absolutely. And Sami, you said your family is primarily living in Nepal and that you originally moved here from Nepal about 24 years ago. As at this current time, there's a lot happening around Nepal and in India. And I think, in contrast to what Kate is saying, where Australia really locked down early and maintained low case counts. I'm wondering if you could talk a little bit about your family that's still there and kind of how the changing caseload there has affected you over the last couple of weeks and months.
Absolutely. Thank you, Angie. So yeah, unlike Kate's family back home in Australia, Nepal is one of the poorest countries in the world. I think it is the second poorest countries in the world. So definitely that plays into how the response has been with COVID. Even though I'm very thankful to the technology, just like Kate, I have been using the messengers, the Viber and whatnot to stay in touch with my family members every so often. But not that I was traveling every so often to go meet them, but I was making a point at least to go back every 3 years or so. And definitely that has not been the case. Mostly because, I have my responsibilities here, but then also the family members, if I was not able to go back home, they would come over here and come visit me. And that has not been the case. And I'm very thankful to the technology that I am able to keep, connected with them and, ask them after their well-being. But I think part of the reason that I do not get the true story out of my family members even is because they worry that I worry too much about them. So even if they're not feeling well, they sometimes, just hide their video and not show their face. And they tell me that they're doing just fine. So stuff like that, kind of bothers and worries me a lot. And as you all know, the situation in Nepal and India is not that great right now. So just the magnitude of the situation is just very worrisome.
Absolutely. And I think looking at both situations, we have a varying response, varying attitudes, varying political, which we won't get into politics on this Zoomcast, but varying political responses to different COVID non-pharmaceutical measures. And I wonder if you could talk a little bit about the contrast that you've seen in response from your friends and family in Australia or in Nepal, if they're experiencing those same range of spectrum of response attitudes in those two countries, and kind of how you respond to their input as you guys have talked through the varying differences in both responses. Sami, if you want to start.
Sure, absolutely. So when COVID initially happened, I think Nepal took a really good stand on, locking down the country, closing down the borders from India. And they were able to really maintain that number significantly at the initial stage of COVID. Then came, the notion that, because the numbers were controlled, there really weren't too many cases happening in Nepal at the time. I think there was a misconception that kind of grew, people started thinking that, our immunity is so strong that, we're not going to get COVID. Look at the numbers in Nepal, we are so well off. So everything started to kind of open up. And obviously, with the lockdown, there's a socioeconomic impact. People who, being one of the poorest countries, as I implied, people who make day-to-day earning were definitely impacted severely. So the government was compelled to open up the country so that people could make their earning. And then Nepal has lots of festivals where people gather, and hundreds and thousands of people gather during these carnivals and whatnot. So recently we had a huge event or a festival that, kind of made that people gather and celebrate the festivities, and that kind of acted as a super spreader event too. So all of these complexities are adding up and in boosting the number of the COVID patients in country. Even though people were, taking all of the non-pharmaceutical measures initially, that misconception of, we are so strong from an immunity standpoint, all the spices that we eat is all good and it's building our immunity. People just kind of put their guard down and not wearing their masks or not taking the precautions that they need to take, washing hands and things. And I think that has had a big impact on how the COVID is spreading back home.
That's right. Kate, do you get that same sense from your friends and family in Australia? Or I know you said that it was likely looking like 2024 before they would allow international travelers. And they did implement really strict measures early on. Both of you working in the public health arena, and Kate, you being a nurse, as you kind of think about what you've seen play out here in the United States compared to what has happened in Australia, do you have, insight from your perspective, but also anecdotes you've gotten back from your friends and family there?
Yeah, I know we don't want to get into a political conversation here, but it was very obvious, that, last year when we had to run up to the election, it became very politicized. One side believed in masks, one side didn't, and, other things like that. What I saw in Australia, though, was, they've got the two parties as well, and I saw them come together and work together, and gave me a little bit of leadership envy, I suppose, in a way. But they did come together, and they realized that they needed to have, public health measures as well as social measures or social support. So when oh gosh, and I think it was like $100 billion Australian that they voted on, they did that in one day. Where when we see, the social support here, it took weeks for our parties to come to an agreement on that. So that was one thing that worked really well in Australia. They did lock down. They locked down not only their international borders, but they locked down their state borders as well. So you couldn't travel from, say, New South Wales to Queensland unless it was, absolutely necessary. And then they also restricted local travel as well. And going from one town to the next town, you had to have a reason. And that may sound a little bit harsh, but, it really worked. People obeyed it, or people, they lived their lives just, making sure that COVID didn't get a hold on them. And, the result of that now is, they have very few cases, they have had some, they have had some COVID deaths that have occurred, but nothing to what we've had here in the US. And it's a shame.
How do you think that affected your family? When you talked about things being implemented here, so we didn't have county level restrictions, we didn't have state travel restrictions for the majority of the country. Some, local municipalities did impose stricter regulations. But wondering, how did that isolation affect your family? And then, as you talked about how things were being implemented here, did they have a response to what they were seeing on the news or hearing back from you?
Right. Yeah. One thing they do over there is they do watch the American news a lot. But, how it affected them was, when we would talk together and, I would tell them, yeah, we're going to the park today or we're going here. And they were like, well, how can you do that? They just weren't able to, move around as freely as what we were. They were also not able to get together. So they were only allowed a certain amount of people that could come to their house. I think it was like one visitor at one time that my mom could have. And she was lonely, so, we had to make sure that, we FaceTimed or, not FaceTimed so much, but, using Facebook Live to be able to talk to them a lot more, just trying to counteract the effects of loneliness for her. But it was very, very different. We definitely had a lot more freedoms than what they had there. But the people, they understood it. There was a lot of public messaging that was going out. They understood why they had to do, they knew what they had to do, and they did it.
So, from your perspective, I know you said early on there was border, restrictions put in place in Nepal. Can you talk a little bit about what that COVID experience was like for your family and friends early? And then I know you said that as things kind of looked stable and restrictions were lifted, more festivities were happening, and now we see what the case counts are with the different variants and things occurring. But I wonder if you could talk a little bit about just how your family and friends have reacted to the changing regulations and just the case counts, and I think also on the other side of that, from both of your perspectives, how has that affected you knowing that you can't help from here? So, I mean, it's a little bit of a personal question, but I think we don't give enough time to ourselves to kind of talk about the emotional impact that COVID is having on everyone.
Absolutely. So when the COVID initially happened,
it was uncharted territory for everybody, right? Nobody had stayed home or had been in the lockdown, even though, Nepal has in the past experienced curfews here and there due to the political instability. But that lockdown was something that nobody had ever experienced. So definitely there was some adjustment to the lifestyle, to getting used to that notion of, hey, we cannot really go out, like, it is not, the culture is not that you buy your groceries for the whole week and then you do not go out. My mom would go out to buy her vegetables every morning. So shift from that was a very foreign to her. Like, she could not go out in the morning. What do you mean I can't go out? So little things like that. It is a very social environment. People go out in their terrace and have tea with their neighbors every so often, and they couldn't do that anymore. So that kind of restriction definitely had a big impact on day-to-day life back home. So just like Kate mentioned, talking to them, explaining to them that it's not just them that they're experiencing this limitation, that it's happening worldwide, and that we're all in this together, and that, oh, by the way, it's not just you, I am suffering the same thing. I also have some restrictions here. If I were able to talk that with them and explain to them the situation, then they kind of got over it and were, I guess, amenable to that situation.
Got it.
But eventually, as the numbers were down, people were getting so anxious to meet up. And as I mentioned, Nepal has so many festivities. Like every month we have at least a couple celebrations, religious celebrations.
Really changed the culture of the country.
Yes. So that shift has definitely taken a toll on everybody. And people are just too anxious to go out on the street and celebrate. And I think that is what happened with the recent event where, people were just not holding out. Even despite the orders from the government, they were like, we are defying that order and going out in the street to celebrate because this is our culture and you cannot stop us from celebrating. So kind of people revolted in that way because there was so much angst and so much desire to be out with the friends and families and celebrations.
So I think that you both brought up, the really salient point of the sense of isolation and kind of and I think not just individually, but the global sense of loneliness that people have experienced. I know both of you have been living in the United States for many years, but wonder if you could talk a little bit about how living here far away from the majority of your family has affected each of you, especially working in the public health arena. And if there's anything that you have found that has been helpful that you would say to other folks who are living and working here and have family members still abroad.
Yeah, that is the biggest thing, Angie. Working here and knowing so much is what we do with, what's happening with COVID, and then worrying about, in the early stages, I did worry about what if, my mom gets it. My dad has already passed away, many years ago, not because of COVID, but, worrying about my mom or my brothers and nieces and nephews.
Mm-hmm.
And some of them actually work in healthcare as well. But just sharing with them the knowledge that I have, things that I've been learning, sharing with them some of the resources that we've been making and sending that to them as well. But so, some of the things, you just can't help, my mom, she needed to go buy a new washing machine, and I can't do that whether it was COVID or not. But it still makes you feel a little bit useless or helpless when it comes to thinking about how can you help care for your parents. And my mom's not going to thank me for saying this, but she's 84 this year, and the thought that we might not be able to travel there till 2024. What if something happens? What if she fell and broke her hip, or something worse was to occur? That's the fear I have. I feel very fortunate. I'm not in Sami's position, where in India and in Nepal, where, you know, so many people are sick, and, you know, it is definitely a crisis over there right now. Australia, I don't have to worry about her getting COVID, but I do have to worry about the normal life cycle. And, you know, what if I can't be there? That's the scary part. What do I do to cope? You know, I try to contact them as much as I can. We keep in touch, you know, as I said already. I, you know, play online games with my brothers. That definitely helps, because that's like daily touch with them.
Yeah.
I make things, you know, I'm making something right now for my mom that, yeah, was supposed to be for Mother's Day, but it's going to be a little bit late. But you know, those kind of things, that helps.
That's great. Thanks, Kate. Sami, anything else that you would add, or different perspective at all?
I actually wholeheartedly agree with Kate. You know, just being here, and you know, Angie and Kate, that I am not from the healthcare background, right? So when I came to know about all of this was nearly 2 years ago, about the infection control and all that stuff. So watching all the things that we do here and the facilities that we have, and kind of knowing that back home people may not have the education or may not have the resources to even do the basics in terms of infection control, is heart-wrenching. It's like the inequity of not having resources back home that I know of, is very difficult to fathom. And but that's at a system level. At a personal level, I know that, you know, my family tried their best. Luckily, my mom is here now with me. She came 2 weeks ago, so I'm very grateful. But up until she could travel, we were all very worried about my mom too, just like you, Kate. You know, my mom is 75. So we were all kind of in this together to make sure that my mom did not get it. So it was very difficult. And just like Kate, you know, the only way to cope up with was making sure that we make, you know, light of the situation, just converse about it, talk through it, and understand that, you know, actions have consequences, and making sure that everybody is following through on what the guidelines are. And I was sharing some of the information that I have learned over the years working with you, Angie, and Kate. So yeah, it's just, you know, me being the expert about infection control, I think helped a little bit back home.
That's great. You know, I think what's been interesting is because from my perspective, and my family is mostly local. I have some far-flung cousins who work in the military, but most of my family is here. And even here, you know, we started to realize how much we take for granted being able to see each other. And I feel as if we have all started to put more effort into having more frequent phone calls, you know, having a text message conversation, FaceTiming with nieces and nephews more. So this is maybe an odd way to ask, but do you feel that because you had that sense of urgency and you knew that you couldn't see people in person, you've actually had more contact with family over the last year in virtual ways, or do you think that it's been about the same?
I think I agree with you, Angie. I think that the frequency has definitely increased, mostly because of the unknowns, and that there is, you know, the crisis at hand. And what if I am not able to, you know, that unknown always kind of bothered. And so I made sure that I stayed in touch. But on the reverse, I also have realized that the folks that I meet with regularly before COVID happened, that list, the list of friends actually has condensed quite a bit. So the quantity has shrunken quite a bit. And I am only in touch with the friends who definitely I know that care about me, and not, you know, in touch with everybody else. So there's been a weird shift, which, you know, it's interesting.
Yeah, that is true. I think it kind of shows the, you know, the value of quality relationships over quantity. But I think that that's been seen in many ways over the last year.
Mhm. Yeah, I think sometimes, we take for granted as well. So I would say that, I reached out to my family a lot more in the beginning last year. Now we may be back to, how it was before, where, it might be a few days, maybe even a week or two before, I'd really contact her and spend a lot of time on the phone call. But yeah, it's easy to just get wrapped up in our lives and take for granted. And it's, to see this as a new normal, which I don't really want it to be that.
I think I just have one more question for you both, and kind of on the opposite end. Do you feel that with your family members being far apart, that they worried more about you being here when we were kind of going through either activations or the different surges or civil unrest and all of those things that have happened over the last 12 to 18 months, as the case counts and other things happened and not at the same time? Do you feel that your family members there had more worries for you being here and wishing that you were there?
Absolutely. Yeah. Yeah. Like I said, they watched the American news. They saw what was happening. They were able to, the civil unrest as well as the, what's going on with COVID and knowing, that, as healthcare workers that we're in the midst of it. And, in their view, they were seeing this as I was a much higher risk for getting it, but then trying to tell them that, Mom, this is what I do. This is, I know how to protect myself. Trying to help her to see that or understand that, even though, she was a nurse as well, but it was different. She definitely worried, and and I would get Facebook messages every now and again, just she'd be saying, are you okay? Are you doing all right? And, she just needed to know that.
Sami, how about you?
Absolutely, just the same. Yeah, people outside of the United States, I think, are more aware of what's happening in the United States. We focus more on what's happening internally, I think, and not pay much attention to the outside world, even though we do, but not to an extent where outsiders pay attention to what's happening in the United States. So definitely the case. My mom was very worried. So she knows that. So she's not educated, and she knows that I work in computers. That's all she knows about my degree. But then she knew that I had kind of made a shift to work at a hospital. So that really worried her that I was working at a hospital. And she asked me if I could go back to the computer job and not work at the hospital. But then, then some of my family members were like, no, this is the time when you make a difference. You do not run, if you're a soldier and you run out of the battlefield, you're not a soldier anymore. So you're at a hospital, make the best of you time of it, make the impact, make the contribution. So yeah, it's definitely worries, but then also definitely encouragement to make a difference and be part of this crisis and make an impact.
Well, I can tell you, Sami, that your support has been invaluable. So your family should rest assured that you're doing a great job in helping.
Thank you. Very proud.
Yeah, very proud.
All right. Well, I think we're coming up on time. I know we will wrap up here shortly. I want to ask for both of you if there were any last minute thoughts that you want to share or things that you would impress upon others. I think that maybe are in the same situation where they're living and working here and have family here, but also family and friends abroad. I think any last kind of encouragement words or things that you would want to share with the larger audience.
I think this is really great, Angie, that, just like you said earlier, we are so inundated with the day-to-day stuff and taking care of others that we really do not talk about how we're feeling ourselves, right? We feel, but we do not get to process. And this has definitely given me an opportunity to kind of internalize and process my thoughts and how am I feeling? What are my thoughts about what the interaction was with my family members back home? So this has been such a valuable experience. I was thinking about the stuff that I would mention, last night, And it was giving me goosebumps, like, I really had not talked about this with anybody. So this is very valuable. Thank you for the opportunity.
Well,
Yeah.
thank you for joining.
Yeah, I think I would just like to say that, for everybody that has family overseas and you're not able to travel to see them right now, just know we're all in this together. We're all here to support each other. And, and in some situations, like in Sami's, where, it's not as good. Her country is, having a much more difficult time than my family are having in Australia. But, there's still that loneliness, there's still that separation going on. And it's difficult for everybody, but, together, we're going to fight this. And if I could just say one thing, and that is everybody get vaccinated. We can get back to a much more normal if we can, do that. And let's share that vaccine with the rest of the world.
Absolutely. Well, I do really want to thank both of you for being willing to be on this session. I think it's not easy to talk about some of these emotional topics, and to be willing to be vulnerable and just to have a candid conversation, with the three of us, but also with the rest of the audience who will tune in. And I think that I've taken a lot away from this. I do take for granted that my whole family is here, and I often complain about how close they are sometimes. But I think that it's very humbling to realize that there's so many other additional factors that people are dealing with on a daily basis. And it does remind me that we need to give each other grace. And to your point, both of your points, that, we are making a difference and we do need to support each other, even if it's just taking time over coffee, or in this case, a Zoom session to give us time to connect and remember the human factor that's here. So thank you both for your time today.
Oh, you're welcome,
Thank
Angie.
you.
And by the way, I like hearing your stories about your family. So it kind of like helps me to, deal with what's going on.
Yeah, good.
Yeah.